Welcome dear students, I am Dr. Pratyusha, and while learning about rehabilitative methods, we have completed learning about all the types of hearing aids. And now let us come into implants, and what you have to learn in implants is cochlear implant. What is a cochlear implant? It is an electronic device that can improve hearing in people who have severe to profound sensory neural type of hearing loss, in whom the hair cells of cochlea have degenerated. When the hair cells of cochlea are degenerated, what we try to do is, we try to directly stimulate the auditory nerve with the help of this implant. Okay, that is broadly what a cochlear implant is. Okay. So, in brief terms, what is it? It is an electronic device. And what does it do? It stimulates the auditory nerve. And why should it stimulate the auditory nerve directly? Because in people with degenerated hair cells of cochlea, degenerated hair cells of cochlea. Okay, this will improve hearing and communication in whom? In people who have severe to profound hearing loss. And what type of hearing loss is this? When the hair cells are degenerated, it is sensory neural type of hearing loss. Cochlear type. In sensory neural also we have cochlear and retrocochlear. This is cochlear type of sensory neural hearing loss. Those people can get benefited with these cochlear implants. Now what basically happens is, the hair cells are degenerating so much that even if you amplify sound, they are not able to pick it up. With conventional traditional hearing aids, when you amplify sound also, these hair cells are not able to pick them. So using those hearing aids becomes ineffective. Then the solution that we have found out to this problem is putting a cochlear implant. Now let us see how does a cochlear implant function. The cochlear implant has two parts. Yes, you have guessed it correctly. An internal component and an external component. The external component consists of what are the parts in the external component? There is a speech processor plus a transmitter. Speech processor plus transmitter. Now this speech processor is worn either on the body or you can keep it behind the ear. Behind the ear is usually preferred. And this will capture sounds from the external environment and it converts it into digital signals. Now why am I not calling it a microphone? Because microphone also captures sound from external environment, but a microphone converts it into electrical signals, whereas the speech processor collects sounds from external environment and converts it into digital signals. Is that clear to you? Okay, so the speech processor collects sounds and converts it into digital signals. So far, so good. And these digital signals are then sent to the internal component. Now let us see what is present in the internal component. The internal component is surgically implanted and it has, repeat, the internal component comprises the receiver or stimulator package plus electrode array. Now what happens is, the external component has collected sounds, the speech processor has collected sounds and converted them into digital signals, and via the transmitter the digital signals are sent into the internal component. Now this internal implant component will convert the digital signals into electrical signals and sends it to the electrode array. Okay, this receiver or stimulator will receive the digital signals. Receives digital signals, and then what it does? It converts them into electrical signals. And these electrical signals are sent to the electrode array. Where is the electrode array present? It is present inside the cochlea. This time we are going so deep, we are going into the inner ear and placing the electrode array in the scala tympani of inner ear. Okay. So these electrical signals are then transmitted to the electrode array. Those electrodes will stimulate the auditory nerve. Now what are we bypassing in this entire mechanism? We are bypassing the external ear, tympanic membrane, middle ear. We are bypassing the cochlea also. Because the damaged hair cells are not able to do their job, we are bypassing the cochlea also and directly stimulating the 8th nerve, and via the 8th nerve the brain perceives the signals. Is this clear to all of you? The external component has a speech processor that picks up sounds, converts it into digital signals. Via the transmitter, it sends it to the receiver. The receiver will collect these digital signals, convert them into electrical signals and stimulate the electrode array that is present in the cochlea. And this electrode array will stimulate the 8th nerve directly, and via the 8th nerve sound is perceived by the brain. Is this mechanism clear to all of you? Okay. Now if I have to explain a little more in detail, what exactly is the speech processor doing? And why can't we directly convert them into electrical signals like the microphone? Because the speech processor analyzes and it codes. Coding is done by the speech processor. There are many coding strategies because we are trying to understand the speech parameters to directly stimulate the auditory nerve. It's all converted into a code that is decoded by the nerve. Okay, some strategies that we use are simultaneous analog strategy, continuous interleaved sampling, spectral peak, advanced combination encoder. Okay, this is not exactly done by doctors, it's a multidisciplinary team that builds such machines. Okay, all this code is created so that the speech is converted into a code and the brain can decode that and analyze it. Is that clear? The electrical impulses, they are sent from the processor to the transmitting coil, and that will send the signal to the implanted receiver or stimulated or receiver or stimulator. How? Via radio frequency. Via radio frequency. Now this stimulator will decode the signal and transmit it to the electrode array. Now there are so many advances in this. We use multi-channel processors where electrodes have linear array. Okay, they can deliver multiple channels of current to different places along the basilar membrane. Now you know that in basilar membrane, different frequencies are picked up in different areas. Now if you put an electrode in one area, only that can be picked up, right? So we have overcome that also. We use multiple channels which are placed in different places along the basilar membrane so that they can pick up all types of frequencies. I told you that this is placed in the scala tympani of the cochlea and it will directly stimulate the spiral ganglion cells. This electrode array which is placed in the scala tympani. It is in close connection to what? Spiral ganglion cells. So the auditory nerve is stimulated and the electric pulses are sent to the brain and they are interpreted as sound. Is this clear? The entire mechanism? In cochlear implants also there have been so many advances, as I told you. We have MEDEL type of cochlear implant, and the next one is a nucleus cochlear implant, and then an advanced bionics cochlear implant system. We have various advancements like that. I'll show you a picture as to how all this looks. Can you see this? This is an advanced bionics cochlear implant system. Okay, what you're seeing here, this is the external component and this is the internal component. To understand the mechanism, please look into this picture. We have the external component placed here like this. All this is the external component and this is the internal component. If you can see, it's coming all the way inside via the middle ear into the inner ear and it's going into the cochlea. Yes, can you appreciate this entire apparatus? I'll erase the annotations so that you can observe better. Can you see the external and internal component? We are directly going up to the cochlea. This is the most important part. Now, if a picture like this is shown, how do you differentiate it from Baha and from middle ear direct drive devices? The middle ear direct drive device is connected to the incus, to the long process of incus here. This is connected to the cochlear. It's going all the way up to cochlear. That means it is cochlear implant. Is this clear to you? Okay. Now, let us see who are the candidates suitable for this procedure. Candidacy profile. You have understood one thing, that is, it's used in children or adults whose cochlear hair cells are degenerating. Okay, but what you have to understand is, this is a highly advanced procedure, and when should you do this? Only when there is severe to profound sensory neural hearing loss, and that too bilateral. Bilateral, severe to profound sensory neural hearing loss, and there is no benefit from hearing aids. When there is such severe loss, hearing aids will not be able to help, isn't it? And of course, there should be no contraindications for surgery. And because this is a very advanced procedure, you should have all the facilities for doing that. And later on also, the patient and or if it is a child, the child's family should have realistic expectations and they should be able to support this entire procedure. What do I mean by that? There is a battery that has to be charged, okay? The external component will have a battery that has to be connected, and the child or the patient should have good IQ to be able to do all this. Now, generally in children with hearing loss, they are a part of syndromes, and if they have low IQ or some other developmental problems, this is also difficult. So we have to think about all these things, whether the family can help the patient rehabilitate and there is enough cognitive function to use this device. All the support and help is necessary, okay? And that's a permanent irreversible procedure, okay? We are putting an electrode inside the cochlea and we are putting an external implant there. This all cannot be reversed so easily. Is it clear? So this is the candidacy profile. Good family support, and it's quite an expensive procedure, so that also makes family support necessary. And good cognitive ability of the patient. Is this clear? Now, this is especially done in children with profound and severe type of sensory neural hearing loss. When you're doing it in children, as I've discussed in the topic deafness in children, it's essential to determine when you're doing the surgery, before speech development or after speech development. If you identify the child in very young stage before 1 year, it is advisable to do it ASAP, okay, because then that will not affect the speech. The child can hear well and speak well, okay. In case the surgery is not possible immediately, at least we have to intervene by using hearing aids, okay, to stimulate the auditory apparatus. Is that clear? Because auditory deprivation, if there is no auditory stimulation to the brain in the early developmental period, it will cause degeneration of central auditory pathways. So later on, if you perform the surgery also, the benefit will not be so much, okay, in terms of learning the speech and learning language and all, even after cochlear implantation, okay. So it's advisable to do it as early as possible. And what can we expect after doing this surgery? To have a good successful clinical outcome, you should, as I told you, the age at which this is done is important, and the neural plasticity within the auditory system is important. If the central auditory system is already degenerated, or if it is not stimulated properly, then doing the surgery will also not have a very good successful outcome. And shorter duration of deafness is better. The shorter the duration of deafness, the better. It's not like every child is born deaf, right? Suddenly they could be exposed to some ototoxic drugs, or something can happen in between. Say the child was born normal, and at the age of 1 year this happened, and the child became, the hair cells started degenerating. So from 1 year, when you do the surgery is important. The shorter the duration of deafness, the better the chances of outcome, okay. And the previous auditory experience, suppose the child could hear for some time, had some auditory experience, and then all this happened, that's also good. It's better than a person who's not having any auditory experience. All these things, are they clear? And regarding the device, using multi-channel implants, they are much better than putting a single channel device, and that is the standard now. Everywhere multi-channel implants are only used, okay. Post-lingual children, suppose after the development of speech and everything, or adults, if they develop this profound sensory neural type of hearing loss and then we do the surgery, the benefit is very, very good, because they have already had good auditory experience and their speech is also developed. So this will help them very much, okay. They will not have any speech recognition problems, okay. And prelingual children will also have good speech understanding, but learning the language could take a period of time, and they require some special training, okay. Verbal training is necessary for them. It's very good if we can do the surgery at 1 year of age. That is the ideal time, okay. Then we can teach the child about speech and other things, and the results are good. So selection of patients is very, very important for this. The main purpose is to determine if the patient is medically and audiologically suitable for an implant. Is this the right solution for the patient is important. And then we should of course counsel the family regarding the procedure and the expected outcomes. So before performing the surgery, what we do is we perform a detailed physical examination and take a detailed history, and do certain investigations. Imaging investigations are done. We perform imaging of the temporal bone, cochlea, auditory nerve, brain, everything. Now you have to ensure that there is no retrocochlear problem, because if there is problem with auditory nerve, even if you do all this procedure, if the problem is with a nerve, even cochlear implant will not help, right? So you have to precisely identify the lesion and then proceed. And doing an imaging study will help you in another way. It will help you while planning the surgery and putting the implant, because if there are any anomalies there, you will be well aware of it beforehand, okay. And all sorts of audiological evaluations have to be done, pure tone audiogram, speech discrimination tests, tympanometry, otoacoustic emissions, brainstem responses, auditory steady state responses, all of them based on the situation, based on the age of the patient and all, you have to do. And you should even try hearing aids and evaluate. That is must before going for this surgery. Okay. So this is about cochlear implant. I hope it's clear to all of you. The main principle that you have to remember is the cochlear hair cells are not functioning and we are stimulating the auditory nerve directly in cochlear implants. So this is about cochlear implants, and after cochlear implants, let us move on to the next type, that is auditory brainstem implant. Now all this is like a chain of events, okay. In the first conventional type, we are amplifying the sound and putting it into the external auditory canal. In middle ear direct drive devices, we are bypassing the external ear and putting it into the middle ear ossicles. We are directly vibrating the middle ear ossicles. And then in bone anchored hearing aids, BAHA, we are bypassing external ear and middle ear also, and we are directly stimulating the cochlea, okay. And then in cochlear implants, the cochlea is also not functional, the hair cells are not functional, so we are directly stimulating the auditory nerve. And here in auditory brainstem implant, the auditory nerve is also not functional properly, okay. Suppose say in acoustic neuroma, that's the classical situation. We are directly putting the implant in the auditory nerve and making it function. All these show the marvel of scientific advancements, isn't it? Okay. So what is an auditory brainstem implant? This is designed to stimulate the cochlear nuclear complex in the brainstem directly. And where will you keep the implant? In the lateral recess of fourth ventricle. Let me write that down for you. The implant, the device, the implant stimulates cochlear nuclear complex. Cochlear nuclear complex, cochlear nucleus in simple terms. Where? In the brainstem. I hope you remember the auditory pathway. Okay, E. coli, Ma. Revise. Yes, so we are stimulating the cochlear nucleus in the brainstem directly by placing an implant. Where are you placing the implant? In the lateral recess of fourth ventricle. Is this clear to you? Now, when is this advanced procedure indicated? When there is bilateral auditory nerve lesion. It is needed when the eighth nerve has been, say, lesioned off, severed in surgery. When will that occur? Usually in a case of vestibular schwannoma or acoustic neuroma. Now here using a cochlear implant is also of no use because the problem is in the nerve. Even if you stimulate the nerve, nothing will happen. The nerve is not able to transmit that sound to the brain. If it is a unilateral acoustic neuroma, this is not necessary because hearing is possible from the opposite side. But when there is bilateral acoustic neuroma, which is usually the case in type 2 neurofibromatosis, then we have to rehabilitate the patient by auditory brainstem implant. So what is the usual indication? What is the indication? Bilateral eighth nerve damage, as in acoustic neuroma. Okay. So we put this device in the lateral recess of the fourth ventricle and the brainstem implant, now this implant will act like the nucleus to the multi-channel cochlear implant. Except that here the multi-electrode array is not used. We are attaching it to a Dacron mesh and that mesh is placed on the brainstem. The receiver or stimulator has a removable magnet also here. So MRI can be safely performed in these people if at all that need arises. Now in people with cochlear implants, MRI is contraindicated in them. Okay, but in people with brainstem implant, MRI can be done. There is a removable magnet, so we can remove that and perform an MRI. Okay, is that clear? So what can we expect after this? There is improvement in communication, there is awareness and recognition of the environmental sounds, but please remember this is not as efficient as the cochlear implants. This is a highly advanced procedure and very few surgeries like this have been performed in the world, and we are expecting further outcomes, further advancements in this procedure. Okay, so this is about auditory brainstem implant. Now we have completed studying about hearing aids and implants. What is the third one? Assistive devices. Let us look into assistive devices. Now assistive devices exactly do not amplify sound or help in hearing. They are accessory devices that will make the life of a hearing impaired person better. Okay, for example, when they have to listen in some difficult situations, or see, hearing impaired people face a lot of problems. If there are some danger signals, or if an alarm is ringing or the doorbell is ringing, they can't hear all these things. So assistive devices will help in their day-to-day functioning. Okay, so in these assistive devices we have further three groups. First one is assistive listening devices and systems. Assistive listening devices and systems. So they can be, there are various technologies that are involved, and they help the person to listen efficiently even in the presence of background noise, or listen from a telephone, or listen in auditoriums and theatres. They can be used by the person individually, or even for a group we can use them. Like say suppose a group of hearing impaired people are attending an event, using these devices will help. There are various technologies such as amplitude modulation, frequency modulation, or we can use infrared signals. All of them will help. Okay. Second category are alerting devices. What are alerting devices? As I told you, to overcome all these practical problems, they cannot hear a doorbell. So what you do is, there is an alerting device that has been designed. Whenever the doorbell rings, this device will blink. A light appears on this device, and a door symbol appears on that. So this person can keep this device in the room, and whenever that is blinking, the person will automatically become aware. They can use similar devices for alarm clocks. There are some wristbands, okay. Whenever there is a stimulation, the wristband vibrates. Now, in the era of smart watches and all these might appear very obvious to you or very easy, but once upon a time, they were of huge help to these hearing impaired people. So they can wear a wristband that will vibrate, or they can use these alerting devices, alarm clocks that will vibrate on the bed, or even hearing dogs were used. The person cannot hear, but the dog hears, and the dog is trained to go and alert the person whenever there is a doorbell noise, or whenever there is some other noise. Or suppose, see, if these people have to take care of small babies, if the baby is crying also, they cannot listen to it. So this dog is trained in such a way as to whenever it hears some sound, it will go and stimulate, it will go and alert its master. Like that, various practically useful devices have been designed that will make the life of these people better. Okay. Usually the auditory signal is converted into light, because these people can see. Flashing lights or strong vibrations are used so that they become alert. Next. Telecommunication devices also have come as a huge boon to hearing impaired people. Now, that's what I told you. In this era of WhatsApp and messages, All these might appear very obvious to you and very easy, but once upon a time they were designed for deaf people. You know, there was a machine where it's a telephone, and in front of the telephone there was a screen. So this person will type the message, and that will read the message and deliver it to the other person in the form of sound. The other person will speak, this machine will listen to that sound, decode it into words again, and it will appear on the screen. Now, how we give audio instructions to our phones, that way this was designed, and this was designed specifically for deaf people. Such telephones were made where they can write and the other person can hear, and the other person will speak and these people can read. Okay, such devices were used, and of course now life has become much easy and better with all these written communications, SMS, WhatsApp, emails, everything. A lot of written communication has come now. So that makes the life of deaf people quite easy and much better. Okay, so these are various assistive devices that are used, and even in movies, captions and subtitles, what we call now, were of great help to hearing impaired people. They would watch movies like that, reading captions. Okay, so like that there are so many assistive devices that have been made to make the life of these people better and easier. So these are all on one side. If you look at the original classification chart about rehabilitative devices, about rehabilitation, we had instrumental devices and training. So we learnt about hearing aids. We also learnt about implants and assistive devices. Now let us learn about training. Okay, what exactly is done in training? So training of the individual with hearing impairment is very essential. Whether they're using hearing aids or devices or not, training is important. And in training we have various aspects. One is speech reading. It's also called as lip reading. Speech reading means even without the sound, observing the lips of the person who's speaking, these people can understand what is being spoken. Now that is an art which all of us have to some extent. Suppose I say, even without the sound, you could understand something, right? I said, hi, good morning. Certain basic words and all, everybody can understand, but these people are specifically trained in that, and they can wonderfully understand what is being spoken even without the sound. Now, I have seen some small children who have been trained for speech reading, and they can understand so much. It's actually hard to believe that they cannot hear, and at that age they have learned this art, and it helps the patient immensely. Okay, and so this is one. And second is auditory training. What is auditory training? This will enhance the listening skill, and along with speech reading this is used. Now, I'll give you a small example. It's in a noisy surrounding, from a very far distance, somebody has called out your name. If they speak something else, you cannot hear. If they call the person next to you, you will not be able to even hear that, but they can hear. Yes. Similarly, if your name is being called out, you will immediately become alert and you will look. Even if that sound is very feeble, if it's coming from a distance, if it's all noisy around, also you can pick up your own name being called, isn't it? How did you achieve that skill? Because we have got used to that. And second is, if you concentrate also, we can hear better. Sometimes in noisy surroundings, people try to close their eyes and put their entire focus on what is being spoken, and that will improve their hearing capacity, isn't it? So similarly, these people are trained and taught to pick up speech from noise. So even in noisy surroundings, like the way you pick up your own name, they are trained to pick up selectively and concentrate on speech sounds. Okay, so this is useful for patients who are wearing hearing aids and also cochlear implants. And finally, there's something called as speech conservation. In people who have very severe to profound hearing loss, it is so profound that they cannot hear their own speech also. Okay, they lose their ability to monitor their own speech. Now we modify our speech based on what we hear. Sometimes we understand that it is too loud for this particular environment, or sometimes we understand that it is too feeble and we increase the volume. We make various modifications based on what we hear, right? These people have lost that ability because of profound deafness, and we train them with alternative ways by tactile or proprioceptive feedback systems, so that they can monitor their own speech production and there is no difficulty in articulation, in adjusting the volume, pitch of the voice and all. So that is speech conservation. So this is all about rehabilitation. I hope it's clear to you. Thank you very much and have a nice day.